The story leads, 4 people in South Africa have tested positive for the COVID-19 variant, first detected in India. The Department of Health says the 4 cases of the B16172 variant were detected in Gauteng and in KwaZulu-Natal. Each province has reported 2 cases, and all 4 patients have a case history involving recent arrivals from India. The department says all cases have been isolated and contact tracing is being carried out to limit the spread of this variant. The department has also confirmed that 11 cases of the B117 variant, first detected in the United Kingdom, has been found here in South Africa. Meanwhile, 2,191 new cases of COVID-19 have been reported in this country. 37 more fatalities were also reported in the latest 24-hour cycle, taking the death toll to over 54,000. Active cases have risen to just over 26,000. So, with the Department of Health saying that it has detected the presence of the coronavirus variants first detected in India and in the United Kingdom here in South Africa, let's speak now to Professor Adrian Puren, the National Institute for Communicable Diseases Acting Executive Director. Professor, always a pleasure having you on the program. Welcome.
Good morning, Blaine, and welcome, and thank you for the opportunity to speak to all viewers.
Let's just start off in India. This brutal second wave that is ravaging parts of India, a resurgence of COVID-19 cases attributed in part to the circulation of different variants, including the B1617 coronavirus variant. Why should South Africa be paying attention to what's going on there?
Well, we should be paying attention to all variants, but not all variants are equal. And some variants are of interest, as the World Health Organization categorizes it, or it can be a variant of concern. And variants of concern are when we look at what are the changes in that particular virus and what the implications are of those particular changes. So, for example, the variant of concern, as it's now called, shows particular changes that are linked to, for example, increased transmissibility. In other words, it can be a much more rapid, faster person-to-person spread, which is what is being observed in India and, in fact, now in the UK as well. This particular variant seems to be the more dominant variant. The other concern is that there are also changes, not particularly in the variant that's been observed here in circulation in South Africa currently, is that there may well be changes about immune evasion. And that can make things very difficult with regard to reinfection and, for example, our vaccine program.
The 4 cases of the B16172 that have been detected in Gauteng and KwaZulu-Natal, and all have a history of recent arrival from India. In a statement, I was just looking at the statement that was released by the health minister, saying that that travel restrictions will need to be balanced against the scientific realities in order to protect the economy. He went on further to say that these findings are urgently being processed by government, and announcements pertaining to travel regulations will be made after all appropriate consultations have been undertaken by Cabinet. You agree, Professor, with this route being taken, or should travel restrictions be implemented immediately?
It's always a fine balance, and I think there are ways in which we could manage this. As you note, the variants are in circulation. Even though some countries may well have put in specific strict restrictions of people coming in from specific countries, these variants are in circulation. It's really how we manage that particular scenario. And so, for example, in the UK and in other countries, what has been done is really to, when there are visitors from different countries where there may well be the possibility of these particular variants in circulation, is really to either have results of PCR, or, as has been done in the UK, for example, is actually to either test, quarantine, and isolate, and then test during that particular period, and then release those particular individuals. So there are different strategies that one could certainly use, rather than having strict bans, for example.
Look, I understand that the mutation of viruses is a natural occurrence in the life cycle of any virus. But what's your level of concern, Professor, with regards to the rate of mutations?
Yeah. So again, it's difficult to say what will happen. Inevitably, we're going to have new variants. I think it's really the implications of these particular variants. Are we seeing a convergence in terms of the evolution of this particular virus in different geographic areas, leading to, for example, and we've just come out of a so-called second wave, where we had a highly transmissible virus, a likely highly transmissible virus, associated with a really marked increase in the numbers of cases and affecting our rates of admission and deaths, for example. Yeah. So we've just come out of that, for example. And this particular variant that has been identified from India and from the UK share those particular characteristics. So our approach really is around understanding more about this particular virus and the implications around transmissibility and vaccines. And our approach really is, in terms of our management, is how do we control transmission of these particular variants, as well as looking at our vaccine program, and that's going to be really key in terms of managing these particular variants as well. So our approaches are not really going to be markedly different. It's really just the monitoring thereof and the implications. So there may be, as I said, convergence of these particular mutations. In other words, an adaptation of these particular viruses in the context of vaccine, which may make matters easier for us, rather than seeing viruses that are becoming more, if you like, pathogenic, as a contrast.
I heard infectious disease expert Dr. Anthony Fauci say that the best way to prevent viruses from mutating is preventing them from spreading from person to person. And you do that by the public health measures and getting as many people vaccinated as quickly as we can, because viruses will not mutate if they don't replicate, correct?
Absolutely. So for the moment, we're certainly starting to prepare for, I hope, a marked rapid coverage of vaccines in South Africa. But in the interim, I think we still need to continue with the key non-pharmaceutical interventions that we have at our disposal. And that includes the wearing of masks and wearing them correctly, the physical distancing, the avoidance of mass gatherings or super spreader events, closed events, for example, improved ventilation. These are still the key elements that are really going to be critical for us. Even as we roll out the vaccine, these elements are still going to be really critical for us to control further viral transmission.
Back to India and the lessons South Africa can learn from their situation, what seems like a relentless second wave. If you get to that point, Professor, is there anything else besides a lockdown that can break the chain of transmission, that can bring the numbers down at a pace that will minimize the impact on lives and livelihoods?
Well, I think, again, lockdowns, we're not really talking about level 5 necessarily, but I think nuanced approaches to lockdowns, and we may have to do that in certain settings in South Africa, for example. But I think that the presence of the vaccine may well add to that. I think it's very difficult under those circumstances, but I think that combination of ensuring that your population is protected in terms of limiting movement, for example, will be very important. But again, coming to the non-pharmaceutical interventions, and the other important thing, that we've learned from our first and second waves is really preparing our hospitals, making sure they are ready. And again, I come back to the fact that in South Africa, there is a program specifically geared towards our healthcare workers, and I really would like to encourage our healthcare workers to really access that particular vaccine, because we're a vulnerable group as healthcare workers, so we really need to protect them, and I really would really like to encourage the healthcare workers to be vaccinated as we approach a potential third wave.
I often regard them as our angels here on earth. Indeed, we do really need to protect him, because if we don't protect him, who's going to protect us? It's as practical as that. According to some reporting coming out from India, it's a case of, seemingly, if you run out of oxygen, you can run out of breath, meaning you die. Why is this happening at that pace?
Well, I think there are multiple reasons for that. So in terms of what led to the large increases in cases, I think many people have spoken about the fact that there were probably, a decline in the non-pharmaceutical intervention programs, for example, large events, super spreader events, whether they be religious or political, for example, and then the lack of preparedness around hospitals. So you have, and of course, the presence of potential variants, such as the one that we're now seeing in South Africa, leading to large numbers of cases, and therefore leading to an overwhelming number of admissions, and then straining your hospital services in terms of ICU and the need for oxygen.
Yeah.
So those are the key steps, as I said. In South Africa, each province and within each district has its resurgence plans. And part of that is around risk communication. It's also around preparedness of our hospitals. In other words, making sure we have enough hospital beds, making sure our ICUs are ready, making sure that we have oxygen, that the logistics around oxygen is in place, the monitoring is in place. And again, I come back to the fact that we now have, in addition to that, we have vaccines available. So this combination really should work in our favor. And as you've seen from the South African COVID-19 Modeling Consortium report, that in fact we should really be expecting, if we have really strict measures in place to manage the transmissions, our so-called third wave, whenever that happens, and we may well be close to that, should be less than what we saw in the second wave. Gauteng is the outlier, if you like, but that again is a warning to us that we should be preparing, we should be communicating around the risks and really managing transmissions as best possible.
Look, Prof, I know you are not a politician, and I don't want you to get into the politics of the situation in India, but from a scientist's point of view, where does accountability lie in a situation like this?
I think accountability rests at different levels in managing a pandemic. I think the WHO outlines various approaches that governments should take to manage pandemics. So it has, I think, about 5 or 6 pillars, and these are the pillars that I've been talking about, that governments need to say, this is how we're going to manage it. We're going to do the following things. We can have risk communication. We're going to have testing. We're going to have tracing. We're going to communicate with our communities. We're going to engage. And we can have the correct hospital supplies, for example, medication. These are all the key things around accountability. But accountability also extends to communities, to local leaders, and to the individual at the end. And when we have the information that we have as individuals, that we need to then take the risk accountabilities in our own hands, in other words. So we are informed what are the key things that need to be done. And I've spoken often around the so-called non-pharmaceutical interventions. Those are at that particular individual level about wearing the masks, physical distancing, ventilation, avoiding super spreader events, is at the individual level. And that includes business people as well. They're equally responsible around the cafes, restaurants, malls, and so forth. So we're all involved to certain extents, and we all should be accountable for how we manage this particular pandemic.
Yeah. Professor Adrian Puren, as always, we thank you very much indeed for your time and your insight. God bless, be well.
Thank you very much. Appreciate that.
All right.